Chapter 6 from the Lewis book, Complementary and Alternative Therapies, and this is a review from our lecture. This is a look at the difference between a biomedical and an integrative model. The main thing here is listen to the patient's feelings whenever they're using conventional natural therapies. If you point out that herbal therapy is not successful, it really is disrespectful to a patient's own belief system. Specific therapies that are alternative in one culture may be considered conventional in another culture, and these two models are not totally separate from each other, and individuals can incorporate each of these models as they make their own healthcare decisions. The strengths of traditional Chinese medicine include its individualized system of diagnosis and treatment, as well as its focus on prevention. The most common are acupuncture and Chinese herbology. Acupuncture is helpful in chemotherapy-induced nausea. It's also helpful from people who suffer from osteoarthritis. Besides acupuncture, other complementary therapies are going to include like prayer, glucosamine, and yoga. The conditions for which acupuncture is used is not limited to those on the slide, but these are the most common and found to be effective in clinical studies. The quality of herb preparation, though, can vary, so it's important that patients purchase herbal remedies from reputable manufacturers. But many herbs can prolong bleeding time, so it's really important to assess the type of herbs that a patient is using and how recently they were used before a patient especially has surgery. Medications to be aware of like feverfew, ginger, garlic, ginkgo biloba, all prolong bleeding time and should be discontinued before surgery. Now keep in mind, there's a difference between herbal therapy alone that can improve immune function, but is not going to get rid of an infection. Prayer is one of the mind-body intervention used most commonly, and prayer has multiple forms. Meditative prayer involves openness to the divine and does not require words or thoughts. Realistic prayer involves repeating words or phrases and is commonly associated with formal liturgy. Collegial prayer involves spontaneous thoughts and conversations. Intercessory prayer involves making a request for specific needs to be met. Prayer is a personal decision and is not required of nurses, and it is important to explore your own views. Self-assessment allows nurses to help meet a patient's spiritual or prayer needs. It is important to be aware that spiritual care is not an attempt to proselytize or win converts to a particular point of view. It is responding to a patient's expressed need and interventions, and these are by their request or permission. Spiritual assessment and care should be sensitive and based on the relationship of trust. It will involve awareness of a person's culture, social, and spiritual preferences, as well as a respect for their beliefs and religious practices. Spiritual discomfort is a result of a mortality's impact on a patient and family. A patient usually will ask themselves whether their life has been worthwhile. Some wonder what life was meant, what dying means. Is there life after death? And if so, what will it be like? Even the most devout person can have their faith shaken by emotionally distressing events. Others will express anger or outrage. They feel cut off from their own soul altogether and just feel a temporary paralysis of the spirit. For people who embrace religion, questions may come from, how could God let this happen to me? Any spiritual practice that brings comfort, strength, or healing to the soul is considered equally good and can be incorporated into the healthcare arena. Biologically based therapies use naturally occurring substances and include individual biological therapies like shark cartilage to treat cancer or glucosamine to treat osteoarthritis. It can include diet therapy and herbal medicine. Online information sources are not always reliable, and a patient may need some teaching about safe use of herbal medicine. Some herbal medicines interact with drugs, like we talked earlier about ginseng that causes bleeding when it's used with warfarin, and ginseng increases blood pressure. Garlic reduces blood clotting and increases blood pressure. St. John's worts. Now, this causes dangerously high blood pressure when consumed with aged cheeses or Chianti wine or foods that are high in tyramine. Any patient who is pregnant or lactating needs to consult their healthcare practitioner before using any supplements. Manipulative and body-based methods include interventions and approaches to healthcare that are based on the manipulation or movement of the body. Biofield therapies are based on a theory that energy systems that are in the body need to be balanced to enhance healing. Energy therapies are those that involve the manipulation of energy fields. They focus on these energy fields that originate within the body, which is a biofield, and those from other sources, which is electromagnetic fields. Therapeutic touch is a method of detecting and balancing human energy, and this was developed in the 1970s by a nurse and a traditional healer. Healing touch involves the use of practitioners' hands to realign the patient's energy flow. The nurse's role. It's important for the nurse to collect data on patients' use of complementary and alternative therapy. This is especially important because most people do not voluntarily tell their healthcare provider about their use of these therapies, but they are usually shared when the nurse asks for the information. So ask general open-ended questions while remaining non-judgmental and respectful of a patient's responses. Safety concerns include the reliability of the information, the safety and effectiveness of the therapy, and the regulation of the practitioners. Regarding sources of information, patients most commonly get their information from health food stores, informal word of mouth, books, magazines, and the internet. Patients need to be encouraged to seek professional assistance with these decisions. Serving as a patient advocate, the nurse provides information on both conventional therapies and complementary and alternative therapies. Patients should be advised that complementary therapies do not replace conventional therapies but can often be used in combination. Self-care is essential on both a personal and professional level. On a personal level, self-care involves commitment to maintaining one's own level of wellness. Keeping one's body, mind, and spirit healthy is required so that one has the strength to care for others. On a professional level, self-care is important because nurses are role models. They're role models for family, friends, patients, healthcare professionals, and the community. So by demonstrating self-care practices, nurses motivate others to achieve greater health and wellness. We talked earlier about acupuncture, but other things include chronic pain like low back pain, postoperative pain, headaches, fibromyalgia, and chemo-induced nausea. Massages are great, but just not on a patient with open wounds. It improves musculoskeletal, circulatory, nervous system, lymphatic, and mental health. Energy therapies, the healing touch, involve the use of a practitioner's hands to realign the patient's energy flow, like Reiki. Meditation, yoga, and relaxation breathing and guided imagery are often used in stress management, and we'll talk more about these in Chapter 7. The most commonly used herbs. Now, aloe can be used for constipation, psoriasis, genital herpes. Shouldn't use it longer than 7 days. It can lower blood glucose and can cause an electrolyte imbalance, though. Black cohosh, treating menopausal symptoms, generally safe for about 6 months, may also lower the blood pressure. Echinacea may have some benefit in reducing the incidence and duration of a common cold. This is for short-term use, because it could lead to liver inflammation. It should be used cautiously with immune system conditions. Evening primrose. This can be used for eczema, skin irritations, but do not use if there is a history of seizures. Fish oil. There is scientific evidence that fish oil is helpful in treating hypertriglyceridemia. Feverfew has been helpful for migraine prevention. It helps with arthritis. It may increase bleeding though. Long-term use may result in withdrawal symptoms, so need to stop this med, especially 2 to 3 weeks before they have surgery. Garlic is used for hyperlipidemia, and chronic use of garlic may predispose intraoperative and postoperative bleeding. So this medicine needs to be stopped 2 to 3 weeks before surgery. Ginger has been used with nausea with pregnancy or chemo and also motion sickness. It may increase the risk of bleeding, so no more than 1 gram a day if someone is pregnant. They need to stop this med 2 to 3 weeks before surgery. Ginkgo biloba. This is used for intermittent claudication. Ginkgo biloba and glucosamine can affect blood pressure levels and may be contributing to the blood pressure instability of a patient. Ginkgo biloba increases a patient's risk for bleeding, so they must stop this med 2 to 3 weeks before surgery. Ginseng increases mental health and may decrease blood glucose and decrease effectiveness of warfarin. Avoid with breast cancer. Hawthorn is used for mild to moderate heart failure, may add to the effects of cardiac glycosides and antihypertensive and cholesterol-lowering drugs. Kava is used for anxiety, but may cause hepatotoxicity and increasing sedation. Use cautiously with supplements that are metabolized by the kidneys. Milk thistle is used for liver and gallbladder disorders and helps lower blood glucose. Avoid, though, with a ragweed allergy, pregnancy, or breastfeeding. St. John's wort is used for mild to moderate depressive disorder and anxiety. It does interfere with many HIV medications and antidepressants. St. John's wort may prolong the effects of anesthetic agents and increase the time to awaken completely after surgery. Saw palmetto is used for decreasing symptoms of an enlarged prostate, colds, asthma, and migraines. It enhances the sexual drive, but it interferes with birth control, slow blood clotting, increased chances of bleeding when taken with aspirin, ibuprofen, heparin, warfarin, or enoxaparin. Valerian helps with insomnia and anxiety. Chronic use, though, may result in insomnia.